Admiral nurses are essentially dementia specialist nurses. You might find them in other environments. They can work in the community, they can work from GP practices, they can work in hospices, and for us, our Admiral nurses are acute Admiral nurses, so we are based within the acute trust.
Admiral nurses support relatives of patients within our care who have a diagnosis of dementia. We not only support the relatives, but we support the staff on our wards to deliver the highest level of care to patients with a diagnosis of dementia. We also carry out teaching with the staff on our wards through teaching sessions monthly. If the relatives are really upset and the patient is quite distressed, we can offer support along with our colleagues from our psych liaison teams and our mental health support team.
So in order for us to do our job, we have to be able to work alongside MDTs. You know, we are an advocate for that patient, so we have to speak to the doctors, physios, social workers to make sure that that person with dementia is at the centre and the focus of their plans, and make sure that best practice is being used from everybody in the team. It's really important for us to be that kind of middle person for communication between teams to make sure everybody's on the same page. There's estimated to be over 8,000 people over the age of 65 living with dementia in Northumberland and North Tyneside, and that number is believed to be ever growing, so that's why the acute Admiral nurse service is so important.
I think fundamentally our role is to inform and support staff to deliver better dementia care. Our role, I see it, is just making sure that people are aware of what dementia can look like, what that experience might be like for patients and carers, and to look for things to make things a little bit easier. So I guess we're advocates for the individuals, for the people living with dementia and their carers, but also we advocate for the staff to try and make their job a little bit easier, to help with that kind of delivering a more seamless care, I guess, but also to make sure that it's high standard and better quality and people have a better experience when they're in hospital.